Hello, my good people. Welcome to my health talk show today as we keep on educating each other. My name is Dominic, and today I want to educate you on one of the conditions that can affect mostly children, but as well it can affect the adults. So, welcome, and let's go straight to the topic as we keep on nourishing each other or educating each other. So today we want to talk about a condition called nocturnal enuresis. Some can call it, or rather it's best well known as bedwetting, but in medical term it's called nocturnal enuresis. Basically, this is a problem that normally affects children up to a certain age, but it's a problem that can as well affect adults, and it's one of the conditions that can actually, it's a condition that actually can cause a lot of embarrassment. It can cause a lot of psychological problems, especially when it happens to adults or people have reached a certain age that they shouldn't bedwet. So basically, we want to look at what is the definition, or what does it mean by nocturnal enuresis or bedwetting. So apparently, this is involuntary urination, which happens especially at night, and it happens especially when somebody is asleep. So there's that age that someone reaches that he's or she's able to control his or her bladder. But if it reaches that age, but still somebody involuntary bedwets, that is now it becomes a condition which is called nocturnal enuresis. So basically, this is a problem that affects a number of people. It's only that most of the people don't speak about it. Others fear the stigma. Others feel it's embarrassing to say that they have this problem, but it's actually a problem that even adults, women, men, get affected with. So apparently there are two types of nocturnal enuresis or bedwetting. There is what we call primary enuresis, and there is what's called secondary enuresis. So when we talk about primary enuresis, this is the type of bedwetting that starts from childhood. Certain age where you expect that the child should be having a dry, night, but it keeps on bedwetting. So it starts from childhood and goes along. Then we have what we call secondary enuresis, which starts late in life due to maybe some other conditions. So we have those two types there: primary enuresis and secondary enuresis. So basically, we may want to know what could be the causes of this problem. So sometimes some causes may not really be understood, especially with primary enuresis. You just find the child is wetting all through. But sometimes there could be some underlying issues that can cause this. One of it is hormonal problems. So there is a hormone called antidiuretic hormone, which can cause the body to make someone to pee or to urinate less at night. But to some people, the body may have this problem where the body is not able to produce this antidiuretic hormone. So it means somebody is able now to produce excess urine, which normally happens at night. Sometimes another thing is genetical predisposition and genetical problems. So sometimes you've heard of people that it runs in the family. There is a family where you find, the older child was bedwetting, the siblings are also having similar problems. So apparently you may find this kind of a problem running in the family. Another thing is issues with the bladder, what we call bladder problems. So bladder problems here is where some people may have what we call an overactive bladder. So an overactive bladder is where somebody is not able to hold urine for long due to either weakened muscles, sphincter muscles of the bladder, so that find that somebody is not able to hold urine for long. Another problem, another cause is what we call sleep problems. People have issues with sleeping. Others sleep so deeply to an extent that they don't feel it when it's coming out. You find that they're not able to feel the urge, that the urge is coming, so that they're able to wake up and go and urinate. Some other issues is too much intake of fluids, especially before bedtime, and too much of caffeine. So these are some of the things that can as well cause nocturnal enuresis. Also, some medical conditions, especially people who are diabetic, people who may have sometimes spinal injuries. Those are some people who can have this kind of problems. Some even UTIs, urinary tract infections, can as well even cause this kind of problems. Also, things to do with psychological problems can as well cause this kind of a problem. So basically, those are some of the few causes of bedwetting, or rather, nocturnal enuresis. So basically, to manage this problem, you need to identify what could be the main problem or the underlying problem. From there, now you're able to know how to manage this problem. So there's a lot to be done about the treatment, including lifestyle changes, teaching if it's children, waking them up maybe at night to go and pee. Sometimes, depending on what could be the main underlying issue. So basically, there's a lot you can do when it comes to managing this problem. So one of the ways that you can manage what you call home remedies or preventive measures is where you basically avoid taking fluids, especially caffeinated fluids, towards bedtime. That is one of the ways you can always try to manage this kind of problems. So always seek medical help from your doctor or someone who can be able to help you, so that you're able to know exactly what to do. Also, sometimes you can put even some alarms to wake you up. If it's a child or if it's an adult, it can wake you up so that you can go and pee. If you have an underlying medical problem, make sure it's treated. If it's a UTI, if it's somebody who's diabetic and the sugars are not well controlled, make sure they are well controlled. So apparently, how to manage this problem is to know where the problem is and manage the underlying problem. And another thing, don't shy off from talking about your problem. If you have this kind of a problem, always find someone you can talk to, especially your doctor, and he or she will be able to help you. Thank you for listening, and thank you for watching. Keep on following my page and keep on subscribing to my YouTube channel as we keep on educating each other. Thank you, and may God bless.